I've left this bit to the end because it probably is actually the most important and the simplest to put into our menopause armamentarium, because it's not drugs, it's lifestyle. Really healthy eating, nutrition. One of the things lots of women say to me is that they put on weight at the time of the menopause. And that's because the brain lays down fat cells, because fat cells make a weak type of estrogen. The other thing to say is, I know we're not talking about HRT, but it's just a quickie here, if you'll pardon the expression. There's lots and lots and lots and lots and lots and lots of scientific studies been done to prove whether or not hormone replacement therapy puts on weight. It doesn't. Nothing has proved that it does. So rest assured that taking HRT won't make you put on weight. Some progestogens can make you feel quite bloated, and that's worth talking to your doctor about. But getting back to more important things, nutrition, diet, and I don't like that word diet, it's about healthy eating really. High protein, high fat, and very little carbs, ideally no carbs. And when I say no carbs, I don't mean the obvious like rice, cakes, bread, pasta. I also mean root vegetables, so that's beetroot, sweet potato, parsnips, because they are food stores. They contain a glucose, which is energy for a growing plant. And sadly, fruit, because fruit contains fructose. Different types of fruit have different types of fructose, and some fruit is really, really good, like the berries and things. So nutrition is really helpful. I say cheese omelettes are sort of personified, but that's not really helpful if you're vegan or dairy free. So that brings me back to looking at the Royal Osteoporosis Society for stuff with calcium in it, but high protein, high fat generally. So lots of oily fish. Mediterranean diet. It's a diet that we've all read lots and lots about. Michael Mosley, Tim Spector, lots of advocates talk about it. Exercise is really good, not only for your bones, it relieves stress. Pound those streets with your running, but exercise can also be yoga. Yoga is really good for your mental health and your pelvic floor, as is Pilates. There's a really good book just brought out called Pussy Yoga. I have yet to read it, but I couldn't resist its title. Sleep. Oh, when did I last have a good night's sleep is something I hear about all the time. Sleep is really important. Utrogestan, which is one of the progestins I do prescribe, helps with sleep, but also exercise, regular sleep routine. If you're hot at night, have lots of thin layers, wear cotton clothes, wear cotton pyjamas and cotton sheets, and wear layers. If you're hot in the day, a fan is really helpful. One of those little fans that you can buy. The other thing that is quite helpful is a spray. Now there's something on the market that's marketed for, I can't remember its name, but it's marketed to as a menopause flush spray. And the actual fact, all it does is put hot water on your body and it evaporates. One last thing, which I just will mention, somebody said to me once that she didn't want her estrogen, but she solved her hot sweats and flushes by having sage tea, and she was putting 30 sage leaves in a cup of boiling water and drinking that every hour. That worked for her. I personally can't think of anything worse, but if it works for you and it's safe, then that's okay too.